Hi, everybody. Welcome to Mastering Your Fertility TV. Today, we're going to be airing for you episode 21 of our podcast. We are interviewing Parijat Deshpande. She is a high-risk pregnancy expert and the author of the book Pregnancy Brain. And she has some really amazing information to share with us about the mind-body connection and how that affects things like fertility, pregnancy, especially during high-risk pregnancy, since that's her area of expertise, and then just our ability to bring our babies home safe and healthy. So we definitely covered a lot of information with her. We talked about some things from her book. So we're going to go over how stress and anxiety affect the entire process of reproductive health. So we're talking about things like chronic illness before pregnancy, fertility issues, as well as pregnancy complications. We also talk about a really important topic that I think isn't getting enough attention in this space, which is the concept of grief and the many different ways that that can manifest and affect a woman as she's going through this process. And then we give you guys some actionable tips that you can use to help kind of tap into that mind-body connection, better manage stress, and get through some of these challenges that you may be going through on this fertility journey. So this is a great interview. We can't wait to share it with you. Dr. Haley is going to go ahead and introduce our guest really quick, and then we will air the interview for you.
All right, so Parijat Deshpande is a leading high-risk pregnancy expert, perinatal mind-body wellness counselor, speaker, and author who guides women to quickly and effectively release their stress during their high-risk pregnancy so they can manage their complications and give their baby a strong start to life. Her unique approach has served hundreds of women to manage pregnancy complications and reclaim safety and trust in their body that they thought was eroded forever. Parijat is the author of the best-selling book, Pregnancy Brain, a mind-body approach to stress management during a high-risk pregnancy. She is also the host of a popular podcast, Delivering Miracles, that discusses the real raw side of family building, including infertility, loss, high-risk pregnancy, bed rest, prematurity, and healing once baby comes home. And you can learn more about Parijat Deshpande on her website, which we will link to in the descriptions.
Awesome. We hope you guys enjoy the interview.
Parijat, we want to welcome you to the podcast. Thank you so much for joining us today.
Thank you for having me.
Absolutely. We're so excited to go over this information with you. So first, we just want to start off with telling us a little bit about your personal story and how you got into mind-body medicine for high-risk pregnancies.
Yeah, sure. So I was clinically trained in clinical psychology, doing my thing, practicing psychotherapy, teaching up at UC Berkeley, enjoying life. When we decided we were ready to have children, we found out that it was going to be harder than we had expected. I mean, we knew there were going to be some issues, but we didn't realize how many there would be. So long story short, went through fertility treatment. Second cycle, I got pregnant with my son, and it was a very high-risk pregnancy. I developed my very first complication actually before I even knew I was pregnant, and it just kind of snowballed from there. Ended up with about 8 complications, and I delivered him extremely preterm at 24 weeks and 5 days. And it was through that experience that gave me tremendous insight that I never would have had I not gone through this, about what the experience is like for women who are struggling to fight for their baby's life, really. I mean, that's really what we were doing, is trying to keep him alive, keep him in me, and then later in the NICU, just hoping that he survives it all. Mm-hmm. And one of the things that came up, as you can imagine, when you have pregnancy complications, there's a tremendous amount of anxiety. You just so much worry, so much fear about what's going to happen to the baby and all of that. And there was a day I remember I was on bed rest for almost the duration of my pregnancy, almost the entire duration. There was a day I was at home. I was alone. I was so used to working. I used to love being busy, and I was just sitting there alone. Nobody's home, nobody to talk to. All my friends are busy. And so your thoughts start going, right? You're kind of going to all kinds of directions, different places. And I remember thinking, God, I am not typically an anxious person, but my anxiety is through the roof. I can't relax. I am just constantly imagining the worst case scenarios. And for me, it really presented as like obsessive researching. I was on PubMed every day, reading everything I could find, and getting frustrated when I couldn't find new things to read because I'd read so many of them. And part of me was thinking, okay, well, clearly this is not good for the baby. I need to find a way to calm myself down. And there was a moment that day when I thought, okay, well, I could reach out to one of my colleagues, get a referral to a therapist that they recommend who's familiar with pregnancy. And I should probably get some support. And I stopped myself and I said, I know exactly what that therapist is going to do, because I would do the same thing as the provider if somebody like me walked in the door. And as the patient now, that's not at all what I need. I don't need to do any of the cognitive work. It was very clear to me that it was what was happening in my body that was impacting me far more than what was happening in my head. The head stuff was there. I think it's always going to be there. But that was the symptom. That wasn't really the core issue. And it was when I landed on hospital bed rest, I was admitted at 22 weeks and 4 days. And I was on monitor, so they're constantly tracking my contractions. I was already 3 centimeters dilated, and I made a vow. I said out loud to my husband, I will not let stress be the reason why my son is born early, because I could feel it. When my anxiety went high, I could feel it, and now I had monitors to prove it, that every time my anxiety went high, every time there was tension in my body, the contractions picked up. And every time I worked hard to relax my body, the nurses could see the contractions stopped. So that is what clued me in. And it was through that experience when I thought, okay, if we survive this and we get to go home and be a family, I cannot go back to my old life. I have got to come back and support women who are going through this very thing, who are not taught any of these skills, who are expected to believe that you've just got to wait and see, and there's nothing you can do, and whatever happens is going to happen, and that's all you can expect. I wasn't okay with that. And, I think we want to hope that we make it to term. I didn't make it to term. I didn't even make it to the 3rd trimester, but I made it far enough to give him a chance at life. And that is why I do what I do. That if we can give that power back to women, I think everything's going to change.
Wow. That is so amazing.
So
Your
powerful.
story, yeah, is so inspirational. And you really hit on something there where I think many of us think that stress is just in our head, that it's running in our head, but it doesn't necessarily affect our body. We don't recognize how much it's actually changing the physiological workings of our body. So can you talk a little bit more about that?
Yeah, absolutely. So stress, I hit up against this all the time, right? A lot of women come to me and go, well, I don't feel stressed out. I'm happy. I'm calm. And that's exactly where the disconnect is you can feel fine up here, but it's showing up in your body. Because when we talk about stress, what stress really means is a physiological reaction in your body to any number of triggers. They can be mental and emotional triggers like anxiety or fear or worries or depression. They could be physical triggers like not sleeping enough or being dehydrated, poor nutrition, anything like physical pain, any of those triggers. But it all boils down to literally physical changes happening in the body to your immune system, your hormonal system, and your nervous system. And that's where these symptoms that we notice start coming from. And that's really the core of what we need to address, not really what's going on up in the head. That's important, but it doesn't get to the root of what's going on.
Right. But it also sounds like when we are addressing the root of what's going on, then it also addresses what's going on in the head, right? So
Exactly.
it's also like a symptom that gets better over time. So how do you feel like this affects women's ability to get pregnant?
So there's a lot of research. So what we know about stress is that when these changes happen to these 3 different systems in our body, we know that it creates inflammation in the body. We know that hormones are affected. So for women, menstrual cycles can be affected. We know so many different aspects of our reproductive health are very responsive to how well these 3 systems work. And so while there's not nearly enough data as I would love to show these direct connections, what we do know is that when the body is under stress, it does affect your cycles, it affects your hormones, it affects your ability to even respond to IVF medication because of the state that your body is in. That doesn't mean stress causes infertility. I think there's definitely a misconception there that, we don't want to make people feel like they're causing their infertility. As a former infertility patient, I know how sensitive that can be. But what we are saying is it's not just physical and it's not just mental. There is a huge connection in the middle there that does impact your ability to get pregnant. And the impact is so profound that there are plenty of fertility clinics around the country that are starting to provide almost mandatory mind-body services because they know of how much better the outcomes are for women and couples who are going through fertility treatment.
Right. Yeah. Absolutely.
It's nice that they're starting to acknowledge that there's more. It's about more than just bringing together an egg cell and a sperm cell. And if you just get them together and put them in the environment, that it's all just going to work out like that. And we know that that's not the case, and stress can be a part of that, and all these other functional issues that we focus on in our practice can be a part of that too. So it's great that that's becoming more mainstream, if you will.
Yes.
Yeah. In a big fertility clinic that we have up here in Oregon, the Oregon Reproductive Medicine, they actually have acupuncturists that go into their clinic, I think 2 or 3 times a week. And they always have an acupuncturist on board when they're doing egg retrieval. And I think they've really found how beneficial that is for women to just help reduce their stress load when they're going through those type of treatments.
Exactly.
So, speaking of, one of the things that we're really passionate about is encouraging women to find the right medical care when they're going through a challenge like chronic illness, infertility, or a high-risk pregnancy. And so why is it important to find the right team of healthcare providers, and what characteristics in these providers should they be looking for?
Yeah, totally. I think this is especially important in reproductive health when there's so much on the line. There's, a tight window, you might be feeling the pressure of time, and you've got to move pretty quickly. You don't have a whole lot of time once the cycle starts going. And what you want to make sure is you have providers of any sort on your team who trust you. That, I think, is by far the most important characteristic.
Yeah, that's a big one.
Yeah. And it's amazing how that's not a given, which just drives me nuts. You want a provider who will listen to you and trust you. When you say something's wrong, they believe you. And their job then is to investigate and figure out, is there a medical cause for this? What's going on? And then to advise on what to do about it. But that first piece has to be there, that when you say something's wrong, they trust you. I think another piece of it that's really important is to find a care provider who, whenever you hit challenges, approaches those challenges as something we can overcome together. They have this teamwork mentality. They know that what you're bringing to the table as the patient is just as important as their medical expertise. And they really have this perspective of hope for the future, even in the most dire situations. That doesn't mean they're giving you false hope, but they're saying, we can get through this together. Let's figure it out. I think that is so powerful in terms of empowering patients to help them, one, feel like they're not alone in this, and 2, to remember that there are still options, even when it feels like they're all completely gone from you.
That is so incredibly important. I think, some people expect to go into a doctor's office and just have the medical provider in the position of authority, and everything that they're saying is what's supposed to be going. And it just sort of takes the power away from the patient to be able to have a say in their care, to be able to advocate for themselves, to be able to feel comfortable bringing up concerns that they may have about either the approach that's being taken, if they feel like they disagree with something in the treatment plan, that they can't say it. And so, having that collaborative mentality with your healthcare practitioners, I think, is just so powerful.
Yeah. Well, and the trust factor there too. I mean, me as a doctor seeing patients, I find that it's really helpful for patients to be able to bring up that they're working with other practitioners. So I'm working with my acupuncturist, I'm working with my chiropractor, and to really be able to reach out to those other practitioners and say, hey, I'm working with your patient. Here's what I'm recommending. What do you recommend? And just make sure that everybody's on board and doing the same thing and what's best for the patient. So the patient doesn't feel like they're the middleman being like, do you mind that I'm working with other people?
Yeah.
Right. Absolutely. Or they don't even feel like they have to coordinate that care because they know everybody's on the same page.
Yeah.
Just focused on helping you with whatever you need.
Exactly. And then there's no gaps in communication as far as it goes of what supplements are being recommended or what medications are being recommended, physical therapy, etc.
Yeah, I think that collaborative approach is kind of what's missing in a lot of patients' care. And I think some of that is like you see a provider and that provider doesn't want to have their toes stepped on by another provider. And so kind of taking that opinion where you're the only practitioner or doctor that that person needs. And that's a little bit narrow. I mean, I think we all have different skill sets. Like Haley as a naturopathic doctor, me as a nutritionist, there's somebody else that might do acupuncture or chiropractor or therapy or, you know, some other spiritual or mind body stuff, and making sure that like we respect and leave room for all of those different modalities because they can all be helpful.
Exactly. Absolutely.
Okay, so the next question I want to ask about kind of touches on something that you mentioned, which is trust. And we're talking about, you know, trust with the provider, but what about women trusting their own bodies? So why is this so important? And do you think that it's harder for women who are going through things like chronic illness, fertility treatment, infertility, and high-risk pregnancy? Do you think it's harder for them to get to that place where they feel confident and can trust in what their body is telling them?
Yes, I do. I think it's much, much harder. I think it's harder. I think it's hard for a lot of people. Let's start there, because we're not taught how to listen to our bodies. From a very early age, we're taught the answer is always outside. And so like how we teach children how to eat and how to sleep and how to potty train, we don't teach them enough about how do you listen to your own body? What is your body telling you? And let's let that lead. And I think as we grow older, we become even more and more disconnected from our bodies. And then you throw in health concerns, especially in this particular instance, fertility issues, high-risk pregnancy, and we're so scared and we're looking for answers. We're feeling overwhelmed. And so the natural tendency is to say, what does Google say? What does the research say? What does my doctor say? What does my acupuncturist say? What do all these people say? And we don't know how to turn inward first and say, wait, what is my body saying? And I think the importance of that is because your care starts with you and your body. And so you being able to listen to your body is critical in terms of getting the care that you need, because what you share is the only thing your doctor can help you with, or any provider can help you with. So it's important to start listening. But then the second piece of it too is trusting that your body's telling you the right thing. And when your body has betrayed you with losses, with failed fertility cycles, with pregnancy complications, preterm birth, whatever that might be, it's really easy, and I speak from experience, it's really easy to go, my body sucks. Hate my body, can't do anything right, it's broken, I failed. It's really easy to do that. But when we do that, we shut ourselves off from such an important source of wisdom, because we can, I say this all the time, we can think ourselves in and out of anything, but our body never lies. And when we focus on that, when we can pay attention and trust that our body is not working against us, it is trying to work as best as it possibly can to help us be healthy, to have healthy pregnancies. When we go at it from that perspective, we actually regain some power, we regain some control even, because now we have access to information that nobody else has access to. And I found that to be hugely important when I was going through this. And that's why I teach that. And I feel like it's such an important part of the experience of family building.
Absolutely. That's incredibly important. And I think that aspect of, you know, my body failed me, it doesn't know what it's doing, being kind of pushed to look outside for answers because you just don't feel like you can get them within yourself. I think that's really impactful. I think that will resonate with a lot of people. It certainly does with me. I mean, I had this experience before I was educated to know how to look deeper. I ignored a lot of symptoms and things that were going on in my body that indicated, hey, you've got some serious problems with your health and you need to address these before you start trying to conceive again. And that was kind of my wake up call to start like pursuing nutrition and start digging and like getting to the bottom of things, because I started to respect what my body was telling me and want to get to the bottom of it. So yes. That's ultimately how I got here with, you know, this work and being passionate about helping other people.
I'm so glad.
Oh,
I love that.
But I think, you know, one thing that it did bring up for me a lot before I understood was this sense of shame and guilt and self-image issues. You know, I'm sitting here watching my friends and family members get pregnant and have all these babies. And, you know, it's like people, you know, from high school have had 3 and you can't even have 1. And so, you know, you feel guilty or you feel ashamed because you can't do what all of these women are able to do, what you feel you're supposed to be able to do as a woman. So, what advice do you have for people who are struggling with those feelings? Their self-image is down and they're just feeling ashamed of what they're not able to accomplish.
Oh, it's so real, and it's such a powerful experience. It can feel really overwhelming, and I think the first step is really to just acknowledge that you're feeling that way. It really starts with that, because I think there's shame for not being able to get pregnant, and then there's shame for feeling shame, and it just kind of compounds itself.
Yeah.
And so just step back, and I would say first just acknowledge this is how I'm feeling. And from there, so much of it is about reframing how you experience your body, and what is your body telling you, going back to trusting and listening to your body. What is your body telling you? How can we use this as not an end all that determines the rest of our future, but how can we use this as a clue as to what should be our next step? What does this mean? And then, this is also a great time, just kind of for lifestyle purposes, to put up some boundaries and say, you know what, I'm going through a really hard time right now. I really can't go to baby showers until I get to a stronger place. And giving yourself permission to do that, that's completely okay. That is a really beautiful and powerful source of self-care that can really help you go through some of these really hard days.
Completely. Absolutely. So you have a really powerful chapter in your book about grief. And when I read this chapter, I found myself kind of at the end of this chapter, just like seriously bawling my eyes out. My journey has been full of chronic issues, and it just seems like one thing after another. And it's like you figure something else out, and now something else is wrong with you. And now something else is wrong with you. And so there have been all of these kind of losses, but we think of loss and grief in terms of death, but that's not the only way that we can be grieving. And so you talk about the different kinds of grief in your book. So can you share a little bit about that, like the different types of grief that you might be going through from all aspects of this journey, either chronic illness, infertility, high-risk pregnancy, and how we can start to maybe process some of those emotions in a healthier way?
Yeah, definitely. I'm so glad that chapter resonated with you, because that was one of my favorite chapters to write, actually.
Yeah.
Grief is something I'm so passionate about, because I think so many of us carry grief from so early in our life, and we just don't know what to do with it. And we don't realize how it impacts our health and our emotions and the way that we perceive the world. And I think it's just extremely powerful when you are able to release it, what's possible for our health, for our life, for our relationships, and for all of that. When it comes to health in particular, I think there's so many different types of losses that happen. One is a big one is really just a loss of identity. I think there's a big one that happens to a lot of people. Who am I now that I have this diagnosis? Who am I that I can't get pregnant? Who am I that I have to be on bed rest and can't work anymore and can't see friends anymore, whatever that might be? A loss of identity it can leave you feeling really dizzy. You feel like you're not grounded anymore. And from there's so many other types of losses that we have in terms of our identity that we can break down. Loss of a job, it can be financial losses, it can be loss of changes in relationships that happen because you can't keep up with them the way that you used to. The loss of a dream of what you thought this month, this year, this phase of your life was going to look like, what you thought your family would look like. There are so many different types of losses. And I think when we identify that, we really give ourselves the time to accept that those are real, legitimate losses that affect us the same way as a death loss affects us. It gives us the permission to really release them. And until then, they're really going to be stuck. And like I share with my clients all the time, is the grief it's not up here. You can't talk your way out of grief. There are a lot of cognitive strategies that work beautifully with grief. One of my favorites is narrative work, where you tell your story in an empowering way. You create and craft that story to mourn the loss and really make sense of it. But that's only half the piece. The rest of it, especially in the case of chronic illness, infertility, pregnancy, it involves the body so much that there are roots of that grief in our bodies that are coming out in some of the symptoms that we're finding. And especially the symptoms we don't understand. Why can't I figure out why my back's hurting? Everything's coming out fine. MRI's fine. This is fine. That's fine. What's going on? A lot of times I have found in my work, it's really unresolved grief that's sitting right there trying to get your attention, and releasing it from there is when you really find true release from that.
Yeah, emotional modalities and some of these other things, like I'm a really science-minded person. And so I feel like there's this other side that maybe I have a hard time tapping into, like understanding how emotions can store and sit in places in the body. And I feel like maybe that's a little bit of an untapped kind of well of knowledge that's there in my body that, maybe I could work through. And I think a lot of women are probably in that boat as well, kind of sitting with some unresolved things that are physically affecting their body.
There's a really great book actually called, have you heard of The Body Keeps the Score?
Yeah, my favorite. Mm-hmm.
Yeah, it's so good. Do you remember the name of the author? I can't remember the name.
It starts with
a B.
With a B. B. Vaughn something. I can't
Yes.
I need to read this.
We're halfway through his name. Anyway, it's called The Body Keeps the Score. And it's really good. It's about exactly what you guys are mentioning as far as like how, it talks about PTSD and like how those type of traumatic experiences kind of get stuck in your body, and you need a different method, such as the rapid eye movement. What is it? EMDR. He talks about how effective that is in regards to finding a different way of getting that out of your body without just like talking about it. Like talk therapy isn't going to do
Release
that because it's that grief is like, just like what you were saying, is like stuck in your back or stuck in your pelvic area, bowl area. And so, it's a really
and people
great book.
think of that as like not evidence-based, or that sounds woo-woo. And so, I kind of dismissed that part of my journey because I'm like, oh, that sounds like, that sounds weird. And now I'm kind of like, hey, maybe it's helpful that I don't know a lot about this. I think we get to a place where we're so overly analytical, and the more you know, you get a little bit paralyzed with all of the potential options and all of the science. And so for me, it's like, I've recently started doing some abdominal therapy. And I don't know anything about the modalities that she's using on me. She does some Chinese medicine. And so it's just kind of an opportunity for me to go and, be subjected to something that makes me feel good, but that I don't fully understand. And that just kind of helps me let go a little bit and not keep analyzing it in my head and thinking, oh, well, this is supposed to be doing this. And if it doesn't work, then I'll feel this. And if it does work, then I'll feel this. Yeah. So I think that's really powerful.
I think that's amazing. It gets you out of your head and in your body, which is
and major type A people need a lot of help with that. So it can be really difficult.
Absolutely. There's a whole field with a subfield of psychology, psychoneuroimmunology, which does exactly this. It's a brand new field, which is why there's not a whole lot out there, but by brand new, a few decades.
Is that like biofeedback?
That's part of it, but it's the study of how emotions actually sit in your body and how they affect your physical health and how they show up here.
I love that.
Essentially, the entire purpose of that field of psychology, I guess.
That's exciting. I didn't know there was an actual whole field.
There is. Yeah, it's amazing.
Study on it.
I'm excited about that too. Oh, one more thing to learn about.
One more thing to read.
Hey, we are all about knowledge around here. I think even though there's so much that we do know about this entire field of medicine and work with women, there's so much that we don't know. And I think it's important for all of us that work in the field to admit that there's so much that we don't know and be open to learning more. And that's ultimately what ends up helping people.
Yeah.
So on this podcast, we love giving actionable advice to our listeners. And so we wanted to see if there's some like actionable ways that women can walk away with to help them through anxiety when they're going through the process of maybe fertility treatments or even just preparing for pregnancy. And also maybe they're already pregnant and they've come up against some high risk complications. Can you give us some actionable advice?
Yeah, I think a good place to start is to identify, is it actually anxiety or not? I see way too often women coming in saying, I'm anxious, I'm super anxious, that my anxiety is so high. And it really actually is not anxiety. It is often fear or trauma. And they require completely different types of support than anxiety, because anxiety is very future focused. Fear is and trauma are past focused, and they're things that you're carrying from the past now into your current. So it's really important to figure out what the difference is, which is why I spend so much time in Pregnancy Brain actually talking about that specific thing, because I think it's really important to know. When you've figured that out and you know what's going on, one of the fastest and easiest ways of combating anxiety is to get in control. We often feel anxiety because we're overwhelmed and we feel out of control. We feel helpless. We feel like everything's just going to be thrown at us and we don't have the tools to handle it. So a really simple way of starting that is to figure out what can you control. And they can be really small pieces of the puzzle, but they're still pieces of the puzzle that are getting you to where you need to go, which is to get pregnant or bring this baby home safely. So give yourself the opportunity to figure out what those are and remind yourself of how important that is to actually keep that in control. That can include things like diet. Even if you've got, I often hear, I can imagine women with gestational diabetes going, but I can't control my diet. Even within those restrictions, you have choices. And so make those choices consciously. Remind yourself as you're making them, this is my choice. I am choosing, and regain some of that control a little bit. Second piece is kind of what we started out with, is make sure you have the right team around you so that you're not carrying the burden of everything on your own. Make sure you have people who are addressing every piece of the worry that you might have, who've got eyes on you, who've got ears on you, who've got their perspective, so you know you're being completely taken care of. I think there's nothing better than just feeling like, somebody's got me, during a time when you're really scared. And I think the last piece too is going back to, again, what we were talking about, is listen to your body and listen to what it needs. Because sometimes something as simple as you need more water can show up as anxiety. You need more sleep can show up as anxiety. So start with the basics. What can I do that's super, super, super simple and easy right now that's going to help my body at this moment? And then it feeds back into that sense of control, which then creates a nice positive loop, gets you out of that feeling of, oh my God, I can't do anything, and what do I do?
Yeah, I love that. That's really basic advice, but so incredibly powerful. I know for sure, even after postpartum, after I had my baby, I was experiencing a lot of anxiety. And of course, I'm sure it was like sleep deprivation and all that. But that part of getting my body back and getting my mood back and everything that you have to get back after you give birth is just those simple little steps. Make sure you're drinking enough water. Yeah. Try to get a little bit more sleep if you can. Eat your green leafy vegetables. And yeah, it makes a big difference.
It really does.
Yeah. And I think there's for some women, there's maybe this like sense of isolation sometimes. I think I went through this, when I started really experiencing a lot of problems with my health. I would get really anxious about things and there was no one that I could really talk to. My friends didn't really understand what I was going through. A lot of them, because I didn't have anything diagnosed yet, I went through this long process of trying to figure out what was going on with me. I got called a hypochondriac. I lost friends. They stopped being sensitive to what I was going through because they were just sick of hearing it. And I just don't remember either. I didn't know that I could find a group on Facebook or whatever that was dealing with things like that, or, Instagram, or some of these really great communities where if you can't find somebody in your immediate, circle that kind of gets what you're going through, that there's other places you can go. But that actually kind of brings up another question about comparison. And this comes up a lot on social media because you get these groups of women who are struggling to conceive, and then some of them get pregnant. Mm-hmm. Or some of them have really severe issues and others don't. And people are trying to find, some common ground with people, but that can bring up issues of comparison, jealousy when people get pregnant, and then just some other negative emotions around seeing what is happening in other people's circles. How do you recommend that women deal with that and process those emotions, but still get what they need to get out of that community? Where is that line?
Yeah, it's so tricky. I think there's a couple pieces here. One is if you feel jealousy coming up, resentment coming up, any anger, one, don't judge yourself. It's very, very normal. We've all been there to some degree. It's totally normal. And two, know that those are really masks for unresolved grief. What loss have you not looked at that you haven't grieved and really mourned? And they're often very basic losses that we kind of brush off and go, oh, that's not a big deal. Oh, whatever, I'll, start working out again later. But if working out was a very core part of your identity, that's a pretty tremendous loss when you can't do that anymore, for even if it's for several weeks, and you know you'll be able to get back to it once the baby's born and all of that. It's still a tremendous loss at the moment. So any of those feelings like that, recognize that there's an underlying loss with unresolved grief that's associated with that. I think the rest of it also, when you're looking at stories, it can go either way. You can get maybe jealous or kind of feel like, oh, why can't that be me? And other times you can get really scared because you go, oh my God, I don't want that to happen to me either. And I think for either one of those cases, it's really important to go back to your body and say, okay, these are other people's stories. This is what's happening to them. This is educational, but what is my body telling me? Am I actually having contractions right now, even though all these other people have had contractions around the same time, for example? Okay, no, I'm okay. And really getting grounded and centered in your body and using that as a source of truth for yourself, and using the group as a source of comfort and camaraderie for the emotional experience, the journey part of it, without it actually defining what your path will look like.
Incredible advice. Really, really great advice. I just see a lot of women struggling with this on social media, and, a lot of them share their feelings and they post about it. So they're at least acknowledging that, but then taking the next step to how do we turn this into something that is healthy, that allows you to stay grounded in your body and still get benefit from being able to interact with these other women that are dealing with similar issues. So great advice. Thank you.
Can you tell us where listeners, again, can connect with you and learn more about your work? And if you have anything else you want to tell them about your book, Pregnancy Brain?
Yeah, you can go to my website, parijatdeshpande.com. It's just my full name.com. I'm on Instagram at healthy.highriskpregnancy, posting a bunch there. And through the website, or you can go to pregnancybrainbook.com to take a look at the book.
Well, we highly recommend the book. I mean, I think that this is valuable information, whether you're currently pregnant and are in a high-risk situation. If you're going through fertility treatment, you're often going to be labeled as a high-risk pregnancy once you are pregnant. I think that's important to understand. But really, I mean, this is about understanding and trusting, taking control of your body. I mean, there's so many amazing messages in this book that can be helpful for women, whether they're currently experiencing a high-risk pregnancy or not. So I just think that the work that you've put into this and how vulnerable you were sharing your story, because some pretty crazy things happened to you during this time. I mean, all of the things that you dealt with, all the complications that you dealt with. I mean, I just think that this story is empowering, it's encouraging, and I just think that it gives women hope, and it's something that we all need to read.
Oh my God, thank you.
You're so welcome. So thank you again so much for being here today. We appreciate your time, and we can't wait to share this with everybody.
Thanks so much.
Thank you.